All right. Well, I'm Dr. Paradine. I work at Cleveland Equine Clinic. I've met several of you, but for those of you, if you don't know who I am, that's who I am. I've been there 13 years, almost 14. Wow, time flies. Here to talk about metabolic disease. I have metabolic in quotation marks because that's kind of a general term. I'm going to talk about two specific diseases that we generally consider to be metabolic disease. So that's Cushing's and insulin resistance. We'll go through them kind of individually, but they absolutely can have them at the same time. So if you're extra lucky, you can have to deal with both. If anyone has questions at any point, feel free to raise your hand. You can ask them at the end, but if we're talking about one thing, say, treatment of something or whatever, feel free to ask questions. Happy to go more in depth or try and clarify, if I'm being confusing or, not clear on something. I think we could probably all agree that this cartoon has some issues. Yeah. So, like I said, we're going to go through two different things. Cushing's, it's a term that we use a lot, but it's not used much in the academic world. The reason it's not used much is, there's Cushing's in dogs. People can get Cushing's too. And the disease in horses is a little bit different than the disease in dogs or the disease in people. So we generally will talk about it as PPID. So it's pituitary pars intermedia dysfunction. It's a very specific part of the pituitary that is affected in horses. Then insulin dysregulation. We usually use the term resistance, but dysregulation is probably a better term. And then I have up here thyroid disease, and I have it up there because there's a lot of misconceptions. Horses don't really, never say never in horses, right? But horses don't really get thyroid disease or thyroid dysfunction the way people do, the way dogs do. We used to think they did. And so, that's where a lot of this came from and a lot of people testing thyroid levels. But true hypothyroidism just doesn't really happen in horses. Not to the extent that these other things happen. It's a pretty rare case to have a hypothyroid animal. And also, just to touch on it as well, because I know a lot of people do test thyroid levels and they'll say, well, my horse had a low T4. Thyroid levels in horses are not reliable. The T3, T4, I should clarify. So, I don't generally recommend testing for them. I don't think that they give us good information. There's also some your thyroid levels will be low, but you have a normal functioning thyroid. And that is in response to something else going on in the animal. So if you're sick for other reasons, your thyroid levels might look low. And it's not because it's a thyroid problem. So yeah. And turn my microphone on? Oh, it is? Okay.
All you have to do is hold the plus and minus at the same time that I do.
Where are the plus and minus?
It's on the side.
I have a pair button. Is that it? It doesn't say a plus and minus.
Yes.
Okay.
Plus and minus. Okay, ready?
1, 2, 3.
We are good. Thank you.
Okay. So, any questions about why we don't really treat horses for thyroid problems or address that? This will come up a little bit later because we do use thyroid medication, but I'll touch on why and all of that. So, we will start with PPID. Pituitary dysfunction, it can range from just some general enlargement of that part of the pituitary to a true outward tumor. So they'll use the term a microadenoma or hyperplasia, so some sort of enlargement. It's a very chronic, insidious type disease. It creeps up on you. It is fairly progressive, so it will generally get a little bit worse over time. There's some things we can do about that. Not curable. You can't fix can't fix PPID, but we very much can manage it in the majority of cases. There are some cases that do get very resistant and do get challenging, you know, like anything else. Not everyone is going to follow the rules, but generally very manageable. There are some predispositions. That being said, all breeds can get Cushing's. We do see it in an older population, but you know, you kind of think of like ponies, Morgans, Arabians, you know, those type of breeds are kind of the ones that come to mind when you think about your horses with Cushing's. But want to stress that all breeds can get it. So like I said, older horses, so generally we think of older than 15. That's kind of our general population, and when we start to worry about it, I'll start bringing it up to owners when we're out there for other things, especially if they have some of the complaints for some of the symptoms. So those list of common symptoms, long hair is the one that everyone thinks about, you know, your long shaggy horse. I mean, look at the picture. That's, all of you would look at that horse and say, I bet he has Cushing's. You know, failure to shed. And he's, when they get that really long hair, that they've usually had the disease for quite some time by the time they get to have that kind of hair coat. So some of these other symptoms, the abnormal sweating, tendon ligament injury, loss of top line mass or muscle mass in general, those are some of your earlier symptoms. You know, people start talking to me about loss of top line in their older horse. First thing I do is test for Cushing's. Not all of them have Cushing's, but it's absolutely on the list. A symptom I don't have on here is increased urination, increased drinking. That's a fairly common one as well. And then, you know, laminitis. The horses with Cushing's are at a higher risk for laminitis. So, you know, generally anytime we see something that has laminitis, we're looking for, if there's not an obvious reason for it, we're looking for metabolic reasons, so Cushing's being one of them. Cushing's is not related to body condition in comparison to insulin dysregulation, which we'll talk about in a little bit, which can be very much related to body condition. Fat horses can get this, skinny horses can get this. It tends to be more of an age-related disease, less affected by outward factors, management factors like insulin dysregulation can be. So diagnosis, I have phenotype up there. That's in reference to that previous picture. You know, you have that long, shaggy hair coat. You know they have Cushing's. And it's recognized, you know, in the literature that those horses, you know, if money's tight, you can just start them on Pergolide. You don't have to. You don't have to test them. Testing is worthwhile for other reasons, for monitoring, monitoring your dosage, because sometimes you have to adjust your dosage in these horses. So, you know, but you got that picture. You know they have Cushing's. Blood tests. So what we routinely do is either a baseline ACTH, and that's just a blood draw, or we do an ACTH with a TRH stimulation. And so how we decide what we're doing depends on the time of year. You know, it used to be, we thought that we couldn't test Cushing's horses in the fall. And what it actually turns out is it's entirely the opposite. The ideal time of year is to test them in the fall. And what's difficult is, you know, there's a lot of ongoing research about this, a lot of research on these two diseases. So our recommendations are kind of changing a lot. So you might say, but I just heard 2 years ago that it was this, not that. Well, yeah, that's how this is going. They're changing quickly. So in the fall, really they say end of July through November, you don't need the stimulation. A baseline ACTH is good enough. And we have some adjusted reference ranges that we use depending on the time of year, so different reference ranges for the fall. So really the rest of the year, we usually do a TRH stim, and that just helps us pick up some of the ones that are low liars that might not test quite as well. So it just increases the sensitivity of the test. Yeah. So it's a stimulation. So no, that's a good question. So what we do is we give, the TRH stands for thyrotropin hormone. So we give an injection of this hormone IV, then we wait 10 minutes and then we draw the blood. No, that's a very good question. So thank you.
Is that the one that's fasting?
Yes. And some of those recommendations are changing as well. So the ACTH we used to think had to be, the baseline had to be fasting. It does not. We can take it, we don't like to take it immediately after a grain meal, but really you can take it anytime. The TRH sim is better fasting. There are times that, real life and ambulatory setting that we take it and try and adjust our expectation and our interpretation, but ideally it is, yeah. So these other two tests up here, the low dose dexamethasone suppression, that used to be something that was done routinely to test for Cushing's, really fallen out of favor. The ACTH is the best one, or the TRH stim. And again, just to kind of touch on, because of other diseases or similarities in other species, the resting cortisol, not reliable. Resting cortisol levels are not in any way, shape, or form reliable tests in horses. They fluctuate too much during the day. Yeah.
What's going on in the different times of the year while you test? What's going on in the horse's body?
So that's a really good question. And some of it we know and some of it we don't know. So there are natural elevations in the ACTH levels in horses going into fall. And some of this has to do with a lot of seasonal changes. And I imagine, we practice somewhere that has seasons, that this is probably a little bit different if you're closer to the equator, where you don't have seasons. So horses very much recognize the change in daylight and the change in temperature, and that does affect them metabolically. And to an extent, we don't entirely know in what ways, and I'll touch on this a little bit later too when we talk about laminitis, and why we have some horses relapse in the middle of winter. And we don't really know, but it's a recognized thing that these horses will do that. So, what they're doing is trying to figure out our best reference ranges and how to identify these horses depending on the season. And actually the newest recommendation that just came out, it's kind of, I just laugh out of frustration because it's this chart and it's like almost depending on the month, you change your reference range, which, just makes it harder, but it is what it is. We're just trying to learn more about the disease. And anyone who owns a mare can reference some of these changes that they go through depending on the season. And it's kind of similar, to be honest, as far as horses internally recognize these changing seasons.
So is there something, like in the winter, you should be doing different than what you do in the summer and spring?
Maybe. Yeah. If I don't touch on it when we get to laminitis and talking about treatment, remind me. Because I want to, because that is something that we're playing around with, but I don't want to get ahead of myself either. So I have the Cornell logo up here just because that's where our practice sends our tests. They have a really great lab, very reliable lab. They're very much involved in a lot of the research that's going on. So that's why I have their...
College in New York.
Yep, yep. We ship all our blood samples to Cornell.
Really, very good college.
Yes, very good lab. So treatment, Perglide is the mainstay of treatment for PPID. And when I say Perglide, I mean Prosend. There was I don't know, 6-10 years ago that we didn't have Prosend and we used compounded stuff. There's a period of time that we were able to use human stuff, and then human stuff came off the market, and then we were really stuck and we used compounded stuff. Perglide is a tricky drug. It's not very stable. That's why it's in blister packs. If you are any of you are treating your horses for Cushing's, do not open these more than 2 days in advance, because they are in, I think they're packed in nitrogen is actually the environment. It's not a stable drug. If you open up the whole pack, you're essentially wasting like more than a couple pills. So don't in boarding barns, we like to, set up supplements and things like that in advance. You don't want to do that with your Percend, not more than a couple days.
So is that because of the light? I had been told it was because of light.
It's not just light, no,
Just light.
not just light. And it's really not a stable drug. And that's why compounded versions of this drug are no good, because it's not a stable drug, and it has to be processed in such a way, it has to be stored in such a way, and it's just really not an option.
Did you say that's nitrogen based?
I think so. Don't hold me to that.
And with field fertilizers, you've got to be careful applying nitrogen because it'll evaporate right into the air.
So I should clarify, the drug isn't nitrogen based. It's the blister packs. That's why it's not in just a pill bottle. It's in blister packs because it's sealed in, I believe it's a nitrogen based type environment, to make it more stable, to increase the shelf life.
We have a friend that has a horse that's 10%,
It will evaporate
and
from sun.
she won't eat. Is that common?
Yes, yes it is. So that is an unfortunate but very known side effect of Percend, is it can affect their appetite. Usually that's short-lived. For a lot of horses, I will try and tell people to just tough it out for a week or so and see, because a lot of them will come back. There are some that we do have to play around with dosage. Either split it up half in the morning, half at night, or what we sometimes will do is we'll back down and then we will wean them onto the drug. So say I want them on a full pill, but they won't eat on a full pill. We start at a half, and then maybe even a half every other day, and then gradually work our way up over the process of a couple weeks to avoid that effect.
What exactly kind of hormone is Percend if you're not treating the thyroid? What exactly is it?
So it's it affects dopamine, yeah, and it's really the best drug for it. But you have some horses that do, like any drug, there are some side effects, and appetite is the biggest one that we see.
She's basically doing a half, and you can't get her up.
It's hard. Yeah.
Seems like she's gotten very wise.
So, and then you have some horses that just know that you're giving them a medication, and that's a whole different problem. Yeah.
On some of the medication, I had a horse that would not eat it. But what I would do is I would mix it up in some sugar water and just shoot it down
Yes.
his throat.
And they actually have made this drug to dissolve fairly quickly. The reason it was pulled off the human market, I think, is because it was associated with some heart valve issues. So they don't want people crushing it, because then you could potentially inhale some of it. So it does actually dissolve fairly quickly. And we'll do that too, sometimes for minis that need a smaller dose. This will split in half fairly readily. It doesn't quarter that well. So we'll, mix it in some water and then split that dose in half.
So it would be like SMZs where you would put it in the water and shake, and
Yeah.
you dissolve in there, and then you put it in?
Yep. Yeah, and it'll dissolve faster than SMZs will. Yeah.
So it's not the taste of the Percend that
No, it's
something.
I mean, there's a population of horses that anytime you try and give them something, they're going to be funny. But then there are some, it truly affects their appetite. It's not the taste of it. Like some medications, it's a flavor. Yeah. Yes.
If they're not insulin resistant with this, can you put it in sugar water?
Absolutely. Yeah. Apple juice, whatever, whatever their favorite flavor is. Yeah.
I had the vet out from Cleveland. He has a marathon that, and she told me that once it's dissolved and liquefied, for women not to get it on their skin.
I am not familiar with that.
She said, don't.
I'll have to look it up because
Can't remember her name.
yeah. Well, and usually, some of the newer kids have the best information.
Don't get it once you dissolve it. For women, I guess it would be like that.
Like Regimate?
Yeah, like Regimate.
Yeah, I've not heard that with this drug. I'll look into it because that's important if it is. But
Because
Yeah, and I'm not sure how it would affect necessarily, yeah.
To get it on my hands.
I'll have to look into that. I don't know, to be honest, and I'm not aware. The company hasn't made that a forefront of a important side effect for what that's worth. So and this might be good for your friend, for horses that either absolutely won't take Percend or they've maxed out their dose. Really kind of the max amount that we give horses or can get away with giving horses is 3 milligrams, which is 3 pills. And once you hit that, there's a handful of horses that their disease is still not controlled, but what are you going to do? So the second drug, Kebergalene, we use it on those horses. It's an injection. It is something that unfortunately we have to get compounded right now. It's not something that's an FDA approved drug, but it's a really nice option for horses that we can't, for one reason or another, use Pergolide.
Is it like a weekly injection?
Every 2 weeks. Yeah.
And it doesn't affect their appetite, doesn't give that side effect?
Not in any of the ones I use it on. And it's a nice option. Unfortunately, none of these drugs are super cheap. Kebergalene isn't really any cheaper than Percend, but for if your horse can't tolerate it, it's a good option. I have Ciproheptidine up here as well. That used to get used a lot more. I use it a little bit. I haven't, honestly, since Kebergalene came out, I haven't used it in a long time, but can be used adjunctively. It's not a good drug by itself, and it works different. Doesn't work on dopamine like Percend does. It works on serotonin. But I have used it in the past on some horses that you max out or don't tolerate higher levels of Pergolide. I use Ciproheptidine in conjunction with the lower dose of Pergolide to get a little bit of a synergistic action to try and get their disease under control.
When is the best time to feed? Oh, I'm sorry. What's the best method then to feed it? You just put it in their grain
if they'll eat it. My only hesitation is if you have one that's a sloppy eater. I worry that's going to end up on the floor. So if a lot of people will buy those soft treats and stick it in. Yep, and
Because you can smell it a mile away.
yeah, and put in something that's a little bit bigger that they're going to eat, and that way they're getting it. Or some people will break off a little piece of apple and stick it in. I think that way is also a good way. You just have to be sure if you're putting it in their feed that they're actually eating it and not dropping it on the floor or leaving it behind like horses like to do too. Yeah. It is a muscle shot, yep. Yeah.
Does it affect geldings more than mares?
No, not necessarily. I'm just thinking back to like the population that we treat. We probably treat more geldings, but I think that is more representative of, more people are apt to buy a gelding as a riding horse. Yes.
If a person's horse needed that shot, would it be something that they could load the horse up and bring it to you for it, or does it have to be done at home for a rest period afterwards?
No, it can be. It can be done at home, kind of. However, there's different options.
Or
I mean,
bring the horse to
yeah,
you.
yep.
Or is this a shot that you could give yourself?
For people that are really comfortable giving shots, yes. Yeah, kind of depends on the horse and the owner, because there are also then some horses that aren't so good for needles either. That yeah, but yeah, there's options. Let me see. Okay, so just kind of a summary. We don't cure this, but treatment absolutely can slow progression. It definitely improves quality of life. Horses don't generally get euthanized because of Cushing's itself. They get euthanized because of the side effects of Cushing's, laminitis, recurrent infection. If you have a pneumonia that you just can't kick because you have uncontrolled Cushing's or a cellulitis, things like that. So absolutely can improve quality of life, and slow progression. I have the question mark improved lifespan. So no one claims that treating Cushing's is going to improve a horse's lifespan, mostly because these are old horses to begin with. You know, these are older horses. So if your horse in his 20s is, we diagnose with Cushing's, he's kind of getting towards the end of his natural lifespan anyways. You might increase lifespan because you're preventing or treating some of these potential side effects. So, that's the question mark there is, you can't really claim that it improves lifespan, but they're old horses to begin with. So, that probably isn't a fair expectation of treatment. I should also throw out there, we really think about these horses being 15 and older. It is sometimes diagnosed in younger horses. Not common, but I diagnosed a 10-year-old a few years ago. It happens. We don't know. We probably think that there might be a component, especially because there are some breed predispositions, but we also see it in all kinds of breeds. So it does seem to be age-related. So as vet med is advancing and our care for these geriatrics is advancing, these horses are living older, we're going to start to see more age-related disease processes that we just didn't see as much before. So not a great answer for you, but
Years ago, I had a thoroughbred mare that was purchased as a brood mare. She was a great little riding horse, but she could never hold a follicle. And years went by, and I just basically gave up trying to breed her. She was diagnosed with Cushing's, and I'm pretty sure you're the one who put her down. And at the time, we had discussed perhaps as a side effect of her having the Cushing's, which we didn't really know ahead of time because her symptoms were not as outwardly, that was a reason why she could not foal.
Yeah, and that's a good thing to bring up for infertility is also a symptom or a potential thing. And I do put some older brood mares on Cushing's meds. If you have an older brood mare, and we do have them on Presend, it's very safe for the pregnancy. The biggest thing is it can influence lactation. So we do have to pull them off the drug about a month before they're due to foal. Otherwise they won't lactate, and that just causes a whole different other set of problems.
Can this be hereditary?
We don't know. Maybe. There's probably a component, but
If you had a mare that had Cushing's or insulin resistant, if it would be passed on to
there's not a good answer. Yeah. And it's hard too because it's an older disease. So, some of these horses too, for one reason or another, don't make it to old age. And so can you say, would they have gotten it had they gotten old enough? Don't know. There was one other thing. Oh, so I don't have it on here, but, we talked about the testing. So, and, with the phenotype, some of those long, hairy horses can, they have Cushing's, you can just start them on meds. Well, what's really important though, when you test them, is then to follow up and test them, monitor them every so often, because it can be a progressive disease. And just because they've been maintained on one pill once a day for the past 3 years doesn't mean that now they don't need a pill and a half. So to sort of keep track of it, I recommend once we're happy with where we're at, then to monitor yearly with yearly testing. Usually I do recommend that you retest about a month after you start whichever medication you're using, to make sure you're on the right dose. Usually for your average horse, they get started on one pill, which is 1 milligram. Ponies, minis get started smaller, but sometimes if their levels aren't super high, I might start them on a lower dose to see if we can get away with not, giving as much. So serial testing, so about a month after, to make sure you're on the dose you like. and then yearly. And as part of that, because we already talked about how the different times of year can play a role in your testing, I recommend that people try and retest at the same time of year. It's really hard to compare fall levels to spring levels. I can compare spring to spring, I can compare fall to fall, but fall to spring is really hard because you have those natural elevations in the fall. So when we're monitoring, we just want to be consistent is key. So, you know, however that works for your individual. Yeah.
Yeah, so what is it that's going on in the wintertime with their metabolic disorders that, you know, they're testing in the spring versus the fall and vice versa, you know?
So it's some of that recognition of the changing of seasons, and that they do have increasing levels, naturally increasing levels of ACTH. So
In the spring and summer?
no, in the fall.
Oh, in the fall.
In the fall is when those levels go up. And as such, when we test, we use a different reference range for that time of year, because any horse will have a natural elevation. What happens in horses with PPID is that instead of having a moderate natural elevation, they'll just have this crazy high natural elevation. And that's why actually fall is a good time of year to test them, because instead of having...
It could be adjusted if they eat more in the winter or less, or...
Some of that does play around a little bit. I have had a couple horses that do need a different dose in the fall than they need the rest of the year. Not lots of horses do well with just, you know, a consistent dose, but there are a few that do need their dose adjusted depending on the time of year. It's tricky. It's not an easy, straightforward thing. It's really not. So.
Because we have one that's also on levothyroxine powder too.
Sure, and we'll get on that in insulin dysregulation. Yeah.
Point out like at 25, and then same time of the year, have it just the following year, and it goes down.
I'm sorry, could you just pull your mask down for a second?
Have you ever had a horse that pointed out, say, 25 one year, and then the same time the next year they do the same test, and they test out at 17? Have you ever had a horse come down, or is there just...
Like with treatment?
Yeah, with treatment.
Yeah, absolutely. Okay. And that's generally what I look for, is I want their levels to come down with treatment. Yeah, what I'm looking for is for, ideally, with treatment, their levels to be in normal range.
What is the normal range?
It depends on the time of year. Generally less than 35 in the spring. Yeah. So, yeah, that there are some, though, that, you know, that get very persistent. And so what we're looking for more is improvement in clinical signs and a lowering, kind of less than half. You know, if their levels are 1,000, I'd like them to be under 500. That's far away from normal. If I can get them to normal, fantastic. But sometimes you have to be realistic and adjust your expectations. And if I can get their clinical signs to improve and I can get their levels to be significantly less, that's still considered successful. So it's, you know, like lots of things, it's not necessarily cut and dry for all these individuals. But ideally, in a perfect world, yeah, I want their levels to be normal with treatment. Yeah. Anything else before we move on to insulin resistance? All right, so insulin dysregulation, also, you know, used a lot with equine metabolic syndrome. Those are kind of hand in hand, same thing. So, you know, insulin resistance, generally it's increased insulin levels. So what happens is the tissues are resistant to insulin. They're not as sensitive. And so the body has to make more and more insulin to maintain blood glucose levels being normal. So the vast majority of horses can still maintain glycemic control, so their blood glucose is normal. It's technically not type 2 diabetes. Like, you know, we do compare this disease a lot to human type 2 diabetes, but most horses don't lose their glycemic control. Some do, but most don't. So we try and stick with the insulin dysregulation, insulin resistant terms. Yeah, if that's not a poster child, I mean, it's obviously photoshopped, but if that's not a poster child for, you know, metabolic disease, I don't know what is. And so before I move on, I have on here, you know, the increased insulin levels is not good for organs, especially your feet. And so that's really, you know, kind of a driving factor of a lot of the issues we have, is that these increased insulin levels are actually, you know, for lack of a better term, toxic. You know, I don't like necessarily throwing that term around, but it's not good for lots of different tissues in the body. But we really think about it with their feet, with laminitis, that increased insulin level can cause that. So this one, absolutely related to body condition. In the vast majority of the time, there are thin horses with insulin dysregulation. Not often, but they do exist. Usually they exist because we've done a lot to get the weight off. So usually your lean horses with insulin resistant are horses that we've actually been working on for quite some time. Just because they're lean doesn't mean they're no longer insulin resistant necessarily. It just means that now we have obesity is not being necessarily part of the problem. And, you know, depending on their levels, you can usually relax a little bit on your concern for them. But body condition, absolutely, you know, overweight horses are a risk for this. Not every overweight horse has insulin resistance, but they're at high risk. You know, we talk about regional adiposity is a big term that we use for these horses too, to sort of differentiate between horses that are just generally overweight, generally obese, to have these big fat pads. And I know you've all seen these horses because there's a lot of them around. You know, they have the crusty neck, they have fat pads over their shoulders. This is a good picture of it here. Fat pads over the shoulders, fat pads on their rump, you know, the big crusty neck. And they can be ribby and have these fat pads. So, you know, we'll get that complaint sometimes like, oh, I need to feed my horse more, they're ribby. Well, we need to be careful because they've got these fat pads. This isn't just a thin horse. There's more going on here, and we need to really, you know, address some things and be careful about what we do and how we feed this horse. So management factors are really important, really big part of this disease process and treating this disease. Definitely breed predispositions as well. You know, Morgans, Arabians, your Spanish type horses, Andalusians, PREs, you know, ponies, minis, yeah, Rocky Mountains, they're on there too, for sure. We do treat quarter horses, we do treat thoroughbreds. Thoroughbreds, not nearly as often though. Not nearly as often as warm bloods, we see it a lot in. So there's definitely some breed predispositions, but not everyone is, not everyone's safe from this. So diagnosis. Baseline insulin is kind of our standard, our go-to. This one we do try and not take after a grain meal. They can have hay, but a grain meal can influence this and give you false readings on your levels. So we do try and take it not too close to that. You look like you had a question. No. So fasting insulin, it's a little bit more specific. If we have, you know, take it just a baseline insulin, and we're not sure, we're still worried, maybe you're a little higher end of the levels, but we're not convinced, we might come back and take a fasting insulin because it's going to be a little bit more specific. If we don't have the results we're looking for, we're still, you know, man, those levels are normal, but I really think this horse has insulin problems. Can do an oral glucose test. That's why there's a picture of Karo syrup there. Because what we do is we give them 60 cc's of Karo syrup, then we draw their blood at some serial times after to see how their body responds to a big slug of sugar, essentially.
What's the statistical probabilities that even though you're insulin negative, as they get older and are in this disease longer, are they then more prone to become insulin resistant?
So do you mean if they have Cushing's, are they, so
mine's
maybe,
for years,
right,
but I'm also careful.
yeah. And because there is some question about whether or not Cushing's horses are a little bit more prone to insulin resistance. And like I had mentioned before, these two diseases you can have both, absolutely. And you're not going to get your insulin resistance under control if you don't get your Cushing's under control too, because your Cushing, it absolutely they can play a role and be intertwined. So there is some question about whether or not that is a thing. And you're wise to keep looking just to check and be sure. Yeah.
How long should you hold the grain meal before the test?
At least 4 hours. And it depends too, I want to clarify, a grain meal versus like a diet balancer. If your horse is just getting Enrich Plus or Essential K, that doesn't count as grain. So it has to be a true grain meal. Yeah.
And what's normal fasting blood sugar in a horse?
Blood sugar? So blood sugar is going to be in a 100, 110 range. Yeah. A normal insulin level in a non-fasted horse should be between 10 and 40. In a fasted horse, it should be less than 20. Yeah. Can you pull your mask down? Sorry.
Can carrot syrup cause insulin resistance? Because we have a HYPD1H horse,
Sure.
and one of the things we have to do is get her
Yeah, she's in.
sometimes we have to give them 380
Yeah.
cc's of carrot syrup.
If they're having an attack, Caro syrup is absolutely what you want to do. So
Counteract that, we give her a really low sugar and low carbohydrate
awesome.
offset that.
Yeah.
But can I carrot syrup? Because I've never realized you should that for a test.
Yeah, well, and that's too, we want to see how their body responds to essentially a big slug of sugar. So in theory, yeah, probably if you're feeding your horse daily Caro syrup, well, yeah, no, I'm just generalizing. That could influence it, but using it intermittently to treat an HYPP attack, no, I'm not worried about it. Especially if your horse is on low carb feed, if they are getting routine exercise, if they're not overweight. Oh, well. So, those other factors are very important as well. So if you're trying to mitigate some of these other factors, no, I wouldn't be worried. Yeah. So I have leptin up here because you might have heard of it. There was a period of time that we're thinking that leptin might help us diagnose these horses. It's another blood test that can be tested right along the same time as our insulin levels, as our ACTH. Turns out it's not a great test. It more kind of looks at overall obesity rather than true insulin resistance. So I have it up there just in case some of you people have heard of it, but not, in my opinion, not generally worthwhile for looking at these metabolic horses. Treatment. Exercise is in capital letters. This is my little soapbox. If you have a fat horse, you need to exercise it. Exercise is huge. I cannot stress this enough. Huge for improving insulin sensitivity. And it's not just about weight. I mean, weight's part of it. But exercise, fat horses that are in regular work and are fairly fit aren't insulin resistant because they're in regular work. Exercise is huge. Now, you run into problems if your horse is laminitic and you can't exercise them. And that's where you get rock hard place because they need some exercise to help. And that's where all these other things, these medications come in. So, the more exercise, the better. But just, say, you're really busy. I can't go ride my horse 5 days a week for 45 minutes. Okay, can you ride him 3 days a week? Can you ride him for 20 minutes? Some is better than nothing. Your horse has been laminitic. Is he sound enough, comfortable enough that we can walk him for 15 minutes? Anything helps. But if you have a horse that is insulin resistant and has not become laminitic yet, start the exercise. That is going to be huge. So outside of exercise, other treatments. Thyro-L, we use that a lot. That is largely to help with weight loss. And I know, I went on my spiel earlier, horses don't get thyroid disease. This is truly trying to increase their metabolic rate to help with weight loss and help a little bit with some insulin sensitivity too. It's not directly influencing insulin sensitivity, but it can help. Then we have Metformin. That is a drug that is used commonly in human med. I use it a lot as well for horses that are resistant to some of our other management changes and our other treatments. If we still can't get their insulin levels down, we'll put them on Metformin. Or if their insulin levels are sky high, if you're, if your levels come back greater than 200, and remember, it should be between 10 and 40, and you're greater than 200, you're going to probably get on Metformin because we need to act quickly. We need to do everything we can to try and get these insulin levels down to try and, either help treat the laminitis or do what we can so that they don't become laminitic. Supplements, there are a couple supplements out that I do recommend. Metaborol is one, insulin-wise is the other one. And there's pictures up here, Metaborol and then insulin-wise. The component in them, they're similar supplements, so I don't recommend you get on both. It's a one or the other type thing. And I'm going to butcher this name, it's Resveratrol, that is in those supplements that makes a difference. And there's some studies that support that. So, we used to use a lot of chromium and magnesium for these horses that really didn't pan out as well as we thought it would. Yep, absolutely. And I hope, not all, this isn't true for all horses, but I hope that, in the long run, we can get them off of some of the medications and then maybe help maintain them with some of the supplements and exercise and management things. Then the last one, the Sgl T2 inhibitors, that's sodium glucose transport 2, or cotransport 2 inhibitors. This is the up-and-coming medication. It's used in human meds. The second two, the one that starts with an E, because I will butcher those as well, they're new drugs. And the one that starts with a C, those are human drugs. Very expensive right now. They have been used in horses a little bit. Generally are price prohibitive at the moment. But the one that starts with the V, that first one, that is undergoing testing right now by BI and will hopefully be on the market soon. And will hopefully be another tool that we can use for these horses with persistent high insulin levels.
I remember years ago, I think it was isoxaprine.
We use that for feet to treat the laminitis, not necessarily for metabolic purposes. Yeah.
But it became that because of...
Well, and some of these laminitic horses, and we'll touch on laminitis here in a minute, laminitis is such a devastating disease that we get very aggressive and throw the kitchen sink at them to try and get things shut down and minimal damage to their feet and get things get them more comfortable. So some of the meds they get put on are for their feet, and some of the meds they get put on are for the metabolic disease. So any questions on the treatment? Yeah.
Would you recommend a ration balance?
Yeah. So on the next here, I'll just jump ahead. Because dietary management and environmental management is important for these horses. So soaking hay, that pulls out the water-soluble sugars in hay, and you can get your hay tested to check the NSC. But soaking the hay, and then I always have to clarify, don't feed the hay water to your horse. You have to dispose of it somewhere else because it has a bunch of sugar in it. So, but that can reduce the sugar content in your hay. Restrict grass. Everyone knows grass often has a lot of sugar in it. Horses love it. Diet balancers. There you go. Low carb grain. So most of these horses are overweight. Most of these horses don't need grain. And that's where diet balancers come in. These are your easy keepers. They don't need extra calories. You know, they get fed on air. The last thing they need is extra calories. But grass and hay by itself is not a balanced diet. So that's what these products are for, is to provide the extra vitamins and minerals that they aren't getting from grass and hay. Really good products, I think. Lots of horses really should probably be on these products versus different types of grain. You do have horses, your performance horses, your hard keepers that need grain. You know, I have a thoroughbred. He's never going to live on a diet balancer. That's just who he is. But that's huge. That's one of the first things I do. You know, when I'm talking to people about their insulin resistant horse, we talk about diet. And if they're not on a diet balancer, they get switched to a diet balancer. Most of the big feed companies have one. So, you know, whatever you want to feed, Tribute, Triple Crown, Nutrina, they all have a diet balancer. So, you know, you can really use what is most convenient, whatever brand is most convenient for you. And they're all good products.
So instead of feeding the grain, you feed a diet balance.
It comes in a grain bag.
It comes in a grain bag.
And it's a pellet. So no horses are thinking they're missing their grain meal.
Okay.
No one's getting skipped. And you feed it based on the bag recommendations. It's usually around a pound. You know, for your average size horse, it's a pound twice a day. And so you feed it at grain time, you know, so no one's getting skipped. And you feed that instead of grain for your easy keepers.
What's some good name brands?
Purina has one called Enrich Plus. Tribute's is Essential K. Buckeyes is Grow and Win. I forgot what Nutrina's is. Yeah. Nutrina has one. I just forgot what it is. Okay. Yeah, that could be.
Now I see the essential. We feed Tribute, and the Essential K is like 20 or 28% protein. But
yep.
I'm assuming because they get such a small
yep,
amount
that's exactly it. That's exactly it.
And if we can back up just a bit.
Sure.
Now the cresty neck and the fat shoulders and
yeah.
that, what's the difference between that and just a hay bale?
So that regional adiposity, the crusty neck, the fat pads, that is an indication that these horses are not, that they have insulin dysregulation, that they're having metabolic issues, versus your overall fat horse. That I worry about the fat horses becoming insulin resistant. I really do. And I had talked to a lot of people about, we need to be careful about this. We need to, you know, work on exercise, diet, whatever. But it's really kind of a hallmark that this horse is not regulating themselves appropriately.
Is insulin dysregulation the same as PSSM?
No, two very, very different diseases. So PSSM is a muscle disorder.
But it's still metabolically...
Yes, because it's how the horse stores glycogen, or polysaccharide. That's the name, polysaccharide storage myopathy, but it's a very specific disease involving the muscle. And so, yeah, you do treat it with diet. You know, part of the treatment of that disease is with diet, but it's a very different disorder. You know, those horses have no problem with, well, some can, but as the disease by itself, it does not influence insulin. Right. It's just it's a muscle disorder.
I have a gypsy Dana, so that's what I believe.
Oh, sure.
Yeah.
Yeah.
So he has not shown these issues, but I have him on a diet balancer.
Yep.
Grazing muzzle and out 24/7.
Yeah.
Is there anything else that I should be doing besides exercise?
Yeah. No, that's huge. You know, both for both diseases, because sometimes, you know, these diseases can be treated a little bit similarly, like you just said. You know, with your PSSM horse, you want low carb feed, you want lots of exercise, because that helps the muscle. Insulin resistance, we want low carb feed, we want lots of exercise. So they're treated similarly sometimes. Yeah, no, it's different pathologies, different disease processes, but they are addressed similarly. And, you know, gypsy vanners are easy keepers. So, so, you know, keep doing what you're doing.
What was the name of those feeds again?
So Purina's is Enrich Plus, Tributes is Essential K. Those are probably the two most common that we use because they're very common brands in the area. Buckeye has Grow and Win.
Now, Buckeyes used to have one if you're on a grass
Yeah.
versus one on a lagoon.
Yeah, and they've kind of gone away from that because Progressive used to do that too. But I think because there's not that many easy keeper horses that are really on that much alfalfa, that it just didn't sell as
When
much.
you got them on the ration balancer versus a grain, even because like I've got her on a low carb grain, but would you recommend like the Metaborol along with that, or just try just the balancer first?
Is she insulin resistant?
We've never had her tested.
Oh, there you go.
We've never had her tested for it, but it's a good probability.
You know, you're not going to hurt anything by putting them on the supplement. You know, whether or not you truly need to is the question, but you're certainly not going to hurt anything. And if you're worried about her going down that road,
Well, she's rusty,
yeah,
and she's a
you
very
know,
stocky woman.
that's being
And she's got
probably
a
fairly,
neck.
yeah, fairly
And I
proactive.
treated her as though she is.
Yeah. So yeah, you're not going to hurt anything, and very well might help
Okay, 'cause
by
I have
by
her
starting
on
that.
The GC, the Tributes, Common Easy GC Plus, which
Yeah.
is the lowest carb.
Yeah, but how much are you feeding of
I
that?
feed her half the ration that's on the bag.
So, and that's another thing too, just an overall nutrition thing. So people are like, oh, I'm only giving them a handful of grain. Well, okay, that's not probably a lot of calories. That's also not getting enough grain.
Balanced nutrition.
Exactly, balanced nutrition. And so that's where these diet balancers come in, because she'd probably do just as well on a diet balancer than on the Calm and Easy, because you're not feeding her that much of the Calm and Easy anyways. And then there are some horses too that they do need the extra calories from some grain, but it's not necessarily enough grain to be a balanced diet. Well, use them both. Use your diet balancer and then top dress with your, Calm and Easy or Calm Ultra, a pound or two if that's what you need to keep your horse's body condition. But a lot of horses really don't need grain. They need a diet balancer. Yeah.
For the really fat ponies that are trying to lose weight,
Uh-huh.
should they be on the full ration balancer? So if they're supposed to be getting a pound a day? Or should they
No,
be getting
because it's based on body size. So it's like a pound a day for your average 1,000-pound horse. So like depending on the size of pony, it's a half a pound a day.
1,300 pounds and should probably be about 6.
So yeah, probably a half a pound a day would be. And then going into, soaking hay, restricting grass, let me comment on one thing and then I will get to you. Hay bags, using, we want horses to be eating all the time, grazing, they're grazing animals. You get some of these horses, they're vacuums. You give them a flake of hay and it's gone in 10 minutes. So these slow feeder hay nets are really fantastic because it slows them down. That helps with the insulin levels, that helps with their stomach because it keeps them eating, more consistently. I have some people that will take 2 of the slow feeder hay nets and put them both on to make it even harder, to slow them down even further, because some of these horses do need restricted hay. They can't have unlimited hay. You have to feed horses hay or grass. They're, forage-based diet. But these hay nets are really, really helpful for some of these horses too. Okay, what was your question?
I was wondering, switching from a standard ration grain to the diet balancer, will that, I don't want to say it, give the horse what they're looking for, and maybe they would eat a little less? You know what I'm
Yeah.
saying?
No. Horses aren't good at self-regulation, especially your easy keepers.
How when your body craves something,
Yeah.
and they're looking for this, but they aren't getting it. That's
No, I wish that was the case. That would help things out a lot, but unfortunately, no. It doesn't do enough that way. I think you were first. I'll get.
Okay, just a quick question.
Yeah.
I had a mirror that we had sold, and she was beautiful, never had a problem. What the people had her, and she ended up dying from it. She found it on our
Mm-hmm.
I have her daughter. Now, because of that, she's an 8-year-old. Would it behoove me to just go ahead and start? I just got her like on a half a scoop of 12% because
Yeah.
she's a real easy keeper.
Yeah.
Would it behoove me to get the low carb grain?
I'd put her on a diet balancer. Yeah, put her on a diet balancer.
On a diet balancer?
Yeah.
rather than- Okay.
Yeah. Until she tells you that she needs more, you know, your event horses, diet balancer is not enough. You know, some of your show horses, diet balancer isn't enough. They need some carbohydrates to do their job. They need, but what kind? Well, but like Western, English pleasure. So she might do okay with the diet balancer. You'll have to see. Some do. I mean, some of these show horses that are easy keepers, it's, when I say upper level, I'm meaning upper level exercise. The event horses, that are galloping, they truly need some carbohydrates to do their job. Some of these horses, and I'm going to throw hunters in this mix too because they don't work that hard, do just fine on a diet balancer until she tells you she can't. If she gets too thin, and I'm using that term a little bit cautiously because show horses, and this is everyone, show horses, the judges, they like them fat. So be careful, that's a real fine line, be careful about too fat. But if she's really struggling to have enough energy to do her job, if she is, telling you that way, okay, now maybe we need to add a little bit more grain. But a lot of them do just fine on a diet balancer.
Another question, I just thought of when we were talking about that, because in the winter, I become the type of rider where if it's cold out, it's like,
Yep.
for a little bit.
Yeah.
Could you put her like in just the winter months
Yep.
when she's not really being
Yep.
worked? Just put
Absolutely.
her on the car,
Yeah.
And then put her back on something when the
Yeah.
sunlight shines her. Okay.
Yeah, absolutely. And on the flip side, there are some horses that need a little bit more in the winter because of the cold. They don't tolerate the cold as well. But once the spring grass is out there, they don't need as much. So you can absolutely kind of alternate a little bit depending on the season, depending on their exercise level. And that's a smart way to do it, is to alter depending on their exercise level and what else is available. So, we talk about this too in horses that get stalled for lameness reasons. They have a tendon. Dude, cut their grain. They don't, they're not doing anything. They're literally standing in a stall right now. Cut their grain. Put them on a diet balancer. They don't need the calories. They're not doing anything. So, being proactive that way is really a smart way to do it. Okay, I think you had something.
Do you have any recommendations for switching over, like when you are switching over from a grain to a diet balancer, like how to do that over, or would it depend on the horse?
It depends on the horse a little bit. Usually if you're staying within a brand and you're going backwards, if you will, a diet balancer is less carbs than a grain. That's an easier transition than if you're adding grain to it. So if you're staying within a brand that they're used to and going backwards, it, over the course of a week is plenty. Yes.
Is there a difference in hay other than having it tested? Because I'm in a barn.
Yep.
But I tend to stick with first cut grass.
Yep.
Versus.
Yeah, so absolutely. And I do recommend for easy keepers to stick with a first cut. That being said, to truly know, you have to test, which isn't going to happen in boarding, a lot of boarding facilities, because there are some second cuts that have lower sugar than first cut. So you don't know but as a general rule, when we can't test and we don't know, yeah, I recommend sticking to first cut. And actually what's surprising to some people is alfalfa is safe. No.
There's less sugar in it.
Yep. What you need to be careful of, a couple different ways, usually alfalfa flakes, because alfalfa is heavier, that you're not feeding based on volume, you're feeding based on weight. So, you're not, he gets 3 flakes of grass hay, I'm going to feed him 3 flakes of alfalfa. No. That's a lot more hay. And that you are feeding based on body condition. Because yeah, a lot of horses don't need alfalfa, but you know, there are certain situations, and when we talk about, you know, I'm not talking too much about the lean EMS horses, which they do exist, but I'm not talking much about it because the vast population is your overweight EMS horses. Alfalfa is a good product for the lean EMS horse because it is lower sugar and a safe product with having some extra protein and things when you're trying to put weight on. Will you pull your mask down? Yeah, you can. It really, my recommendations on that is a little bit individual dependent, dependent on what else they're getting and their overall body condition.
Pretty muscular, he's not just like people, but he's regularly.
Yeah.
But his ribs are showing, and that's what we were trying to find a supplement that would help with his muscles. But
Yeah. So alfalfa is good. There are some good muscle supplements. Purina has one called Super Sport. Progressive has one called Top Line Extreme. I think, because they're amino acid supplements, and they're the right amino acids that muscles want to help with muscle recovery. Think of bodybuilders that take their protein shake after they work out. That's kind of how those supplements are. Super Sport or Top Line, I think, and maybe someone here can help me, Tribute might have come out with one. I could be wrong. There's another, I heard of another one recently and I forget what brand it is. No, it could be, yeah. But also for your lean horses, fat calories is a lot safer than carbs. So, you know, a lot of times if I have a lean EMS horse, I will have them on a low carb diet and then we'll have them on a fat supplement because that's a safer form of calories for them. I think, sorry, hang on, I think she's first.
Okay, so I'm going to put my mare on the ration balancer.
Yep.
I do ride year round when I can.
Yep.
But when I really start riding, if she's on the ration balancer and I'm heading to Illinois for 10 days and I'm riding for 8 hours a day, she's going to need more carbohydrates for the energy. If she's just on a ration balancer, will adding all that extra to her to give her the energy for what she needs there going to be a, so to speak, shock to her system?
It depends on how you do it. So if she's on a ration balancer and now you're adding 4 pounds of grain, yeah, that's a big difference.
Yeah.
But if you're only adding 1.5 pounds to 2 pounds of grain a couple times a day, yeah, you're okay. Or maybe that's when you want to add in some alfalfa, or maybe that's when you want to add in your muscle supplement as well, because she's going to get better muscle recovery after those rides, after those long rides. Those supplements help build muscle, but they also help with muscle recovery. So, yeah, go ahead.
So the muscle and the amino acid and the muscle supplements, would those be a good choice for a horse like mine with the PSS?
Yeah.
So they're safe?
Yep.
Okay. Hay pellets.
Yeah.
For metabolic horses.
Yeah.
She has to have sugar, really in the teeth. So,
Yep.
is there one Timothy Alfalfa Orchard? Is there one better for metabolic horses than the other?
Probably not. Yeah.
Now, what about eating alfalfa, balancing the phosphorus?
Are you worried about like their calcium phosphorus balance and getting too off? You're probably okay.
There is a difference between alfalfa and hay and regular grass.
Yeah. The amount that you would have to feed to really cause a dietary imbalance is not feasible. Okay. Yeah, so it's pretty safe. Anything else at the moment? We don't have too much more. There's just a little bit more. Laminitis. We just have one slide, but there's a lot to talk about. So EMS horses are the highest risk. Yes, Cushing's horses, PPID horses are at higher risk, but your highest risk individual is going to be the horse that has both. And really, out of the two, the EMS horse has a higher risk than your PPID horse. So this laminitis, it can come out of nowhere, but this usually creeps up on you. You know, they're a little bit lame. They might not be as, you know, your founder where you know they're rocking back and they can't move. They can look like that, but sometimes, you know, sometimes we find it almost, I don't want to say incidentally because it's not an incidental finding, but you know, we're doing x-rays for something else and we're like, wow, you've got some laminar thickening. You got thickening to your lamina. This is a problem. You know, we've unfortunately found these horses on pre-purchases before. It can be very sneaky and creep up on you. And that's where I say, you know, it can be subclinical. I've seen, you know, thickened lamina in horses that are sound. The question is, okay, sound for how long? When, you know, it's not a matter of if, it's a matter of when they will go lame if you don't change anything. It will, you know, this insidious laminitis will creep up on them and it will become a problem if you don't change anything. But it can be, you know, your acute crippled horse. There's a huge variable response to treatment. A lot of these horses are tough in the long term. Some of them respond really well and you can get them back and that's great. But a lot of them, it's a big roller coaster. You have up and downs. They'll get better, they'll relapse, they'll get better, they'll relapse. And whether that relapse is in a couple months, whether that relapse is in 6 months, but it often happens. It's often not just a straightforward, okay, we treat it and they get better. And the hard part is once they have inflammation in their lamina, you know, there's only so much we can see on x-ray. We can't tell what's happening with scarring that's happening in their foot and these little cellular connections that are getting broken down. And so some horses, you know, the ones that respond really well probably have a lot less of that versus the ones that don't respond real well are having a lot more of that. So huge response to treatment, but I can promise you, you will not get their laminitis under control if you don't get their metabolic disease under control. And that's where it gets really frustrating sometimes is, man, you really want this horse to exercise for its metabolic disease, but they're too lame. And that's where we get really aggressive with lots of medications because that's all we can do. You know, there's certainly, you know, trimming recommendations and, you know, things will assess the feet mechanically, but we put these horses on a lot of medication because we get really limited in some of what we can do. And the sooner we can try and get this whole cascade to stop, the better off you're going to be in the long run. And unfortunately, there's no predicting who's going to do well and who doesn't. So it's hard. You know, it's a hard road to go down. And, you know, I'm thinking of one horse in particular, a metabolic laminitis. We were really aggressive in treating it. He came back, he horse showed, he did great, you know, really successful treatment, relapsed again over the winter. Why? I don't know. Probably less exercise, to be honest, but you know, once they have some of that scarring and that change in the tissue in their feet, it sets them up to make it that much more easier to relapse. And, you know, like I said, there's a lot that we don't know going on. You know, we can't take their foot off and look at it under a microscope and put it back on. So, you know, the long-term prognosis, you know, some of these horses do pretty well, but it can, even in the long term, it can be a little bit of a roller coaster because they are at high risk for having relapses and relapsing in the winter. And we're still kind of trying to figure that out. And so some of the treatment, I think you had brought this up. So we're trying some light therapy in these horses to try and mitigate the effects of winter. And kind of like we'll do with brood mares, put light in their stall. They actually make a mask now. It's called an Equilume mask that they can wear that has a light right by their eye that accomplishes the same thing as putting a light in their stall.
Yeah, because he's got all that.
Yeah.
Starting in the fall, he starts.
Yep.
And I mean, literally, he looked like that top right there. I mean, you know.
Yeah.
He couldn't stood like that. He's rocking, you know, all winter long.
Yeah. So we are, you know,
He's running a bucket and running to the bar.
yeah, recommending some light therapy to help. I don't think it's going to be like, you know, the magic wand that cures everything. It has to be enough light. You know, a little dim light isn't going to cut it. It has to be enough light. Kind of, I use the same recommendation that I use for brood mares that we try and get cycling early in the spring. Needs to be light enough that you can easily read a newspaper in the corner of their stall. So it needs to be that much light for 16 hours a day. So you can, you know, if you have 5 hours of good daylight, you need to add on to either end.
Most of the time it's like overcast, you know.
Yep.
Around here. Does that constitute having enough daylight?
It depends if they're inside or outside. If they're out, it can, depending on how overcast. That's a, you know, big gray area. But you want 16 hours of good daylight. So if it's really dreary, no, it's not going to count. If it's just a little overcast, yeah, you're probably getting enough UV light. But, you know, if you're going to err on the side of caution, err on the side of having that light on longer in their stall. Yeah.
This is a different kind of light therapy, but it just came across my mind.
Sure.
If you have like a cold laser, would that help?
Probably not.
Probably not. It doesn't penetrate deep enough? Or?
Correct.
Okay.
Yeah, getting things to penetrate that hoof capsule is the big challenge. Yeah.
That have both of them. Ours doesn't have a problem with laminitis, knock on wood.
Yeah.
But you know, he has a little bit of a clubfoot in the right front, and he gets a crack heel. We just get it cleared up, and it's back again.
Sure.
Is that the same?
No, that's something totally different. Yeah, and the cracked heel probably has to do with the club-footed conformation and different mechanical forces that happen with a club foot versus a normal foot. So that's different. Yeah. But yeah, and some of that probably is more of a mechanical problem because of the club-footedness than a quality of the tissue. I mean, Foyer's formula is a good supplement, but yeah, you have a different functioning foot. Yeah. Yeah. Any other questions? Any about laminitis in particular? I mean, that's a whole big, you know, that we could do an entire talk on laminitis, but yeah.
Yeah, I've been around, well, it's laminitic, but we always use the term founder ponies
Sure.
all my life.
Sure.
And, you know, I grew up with it when I was a kid. Then the same ones founder every spring, but then there could be another one out of the same mare a year later, and these animals were out on pasture 24/7 when I was growing up.
Sure.
Never stalled, and the foal from the next year would go through and have not problem one, never. Is there any kind of condition in the gut that maybe to some of this fescue that grows here that some are have a more of a problem with it than others? You know
Sure. And really we don't know. Yeah, I mean, I think probably the gut does influence a whole lot more than what we even recognize. And I know they talk about that in human medicine too. So we don't know. I'm sure there are some individual variances in genetics as well playing a role with that. And individual differences in body condition. You know, we don't see a lot of young horses that founder or become laminitic. It's usually adult horses, adult to older horses. And I think that has to do with, you know, a little bit of their metabolic state as a young animal versus an older animal. And young horses move more, you know, like, I mean, it's kids. They run around like, you know, maniacs. And so I think that does influence things too, that, you know, usually it's not until they get a little bit older too that we start to run into some of these issues.
I was just asking, you were saying about exercise. if they're just in the pasture, come and go as they please, obviously it's not enough exercise.
Yeah.
But
So when it comes to metabolic disease or your EMS, correct, that's not enough exercise. Now, it's an ideal way for a horse to be, for sure. That's kind of how they're made, is to be like kind of walking around a little bit here and there. So for your average horse, that's fine. But if you have an EMS horse, it's not going to be enough. Better than nothing. I would rather have that, as long as the access to grass is restricted. In one of my pictures, I had a grazing muzzle. So as long as they have access to grass restricted, I would rather have a horse out moving around than standing in a stall. But because, and it goes back to anything is better than nothing, but you're going to want more if you have an EMS horse. There's one study somewhere that showed a significant difference in trotting for 15 to 20 minutes 3 times a week. That much made a significant difference on their insulin levels. So it doesn't always have to be a ton. More is better than less. But doing what you can is always going to make a difference. Sometimes, even best intentions, doing what you can still isn't going to be enough. I've told some people that are having a hard time getting out to ride their horse. A high school kid that can go, trot around a field for a little bit, because we're not necessarily looking for quality of exercise. I don't care if they're on a bit, if they're in a frame or whatever. I just want them to move. I want them to break a little bit of a sweat. I want to get their heart rate up. Yeah.
We're gonna have to cut questions because I'm gonna have to cut this soon. Do you have more?
No, this is my last page is questions. Yeah. All right. Okay.